So a colonoscopy is the best way that we know how to be able to see a polyp and to be able to identify it, take it out so that we can decrease or prevent the occurrence of colorectal cancer.
We're looking for colon polyps or any sort of abnormality as far as tissues or masses, anything that could be obstructing the colon opening.
There are different types of polyps, but they start out kind of small. So if you do your screenings and do them when you're supposed to, then you're likely to catch things early where you can go ahead and remove those.
And some of those polyps are just absolutely benign and your body just grows them. But sometimes they can be kind of nasty, and those are things that we want to remove and be aware of.
Colon cancer can be very preventable and treatable if caught early. So even though you don't feel like you have any issues, it's important to go ahead and have screenings done. They have decreased the screening age to 45 more recently because they have had more incidents of younger people actually having colon cancer.
So we want to make sure that we get people in and get them screened at 45. So we have kind of that baseline look to be able to figure out what's in their best interest for the future.
Everyone should come in at least every 10 years as long as there's no family history of colon cancer or that you personally have had a polyp that was of concern. In that case, it can be anywhere from 5 years, 3 years, 1 year. It just depends on what we're working with and how aggressive we need to be preventative-wise. I think that people don't want to do it because it sounds scary. No one wants to come in and have a procedure like this done.
I think that people are sometimes afraid of the outcome. Although that's a very scary situation, it's much easier if we find it early than to wait.
There are other people that maybe are a little embarrassed for people to see that part of their anatomy. We do this all the time. We do respect your privacy and keep you covered as much as possible in that situation.
I always claim that we're kind of like Las Vegas, whatever happens here stays here.
I would say to relax. It's not as scary as you may feel that it is.
When it comes down to it, it's a 1 day or maybe 2 days of your life that could maybe give you peace of mind for 10 years.
Medically, it's really important. Personally, I feel like it's an easy procedure that you can do that's so preventative for your health maintenance.
It's real important not to be afraid of it and just come on in. We really are very nice people.